In January 2014, the Guy's and St Thomas charity agreed to fund a new programme for emerging leaders in Lambeth and Southwark. The programme, led by the local clinical commissioning groups, aimed to identify and develop new leaders within primary care. Their objective would be to bring about changes that would improve GP services for local residents. We asked them what those changes should look like and how it could be achieved through the programme.
There's an increasing demand for our services from patients, allied with a cut in resources. And I think there's a general feeling is that general practice is struggling. We're struggling to meet the demand, we're struggling to work within that envelope of finances that's being provided to us.
It's kind of frustrating sometimes because we know that the NHS independently has been shown to be the most efficient healthcare system in the world. There's
a general consensus that we need to do something differently in order to survive and move forward as a body or as a profession. One of the key things in order to facilitate that change, we think, is to develop a more effective leadership structure across localities, across boroughs and possibly pan-borough as well, across Lambeth and Southwark.
I mean, we've had the benefit of the NHS service for over 60 years now. It's not going to be there in the next 60 years if we don't make changes.
The work-life balance of individual clinicians is being affected, and general practice is becoming a slightly less attractive place to work in. So what we're finding is that there's beginning to be a slight recruitment crisis in general practice. A lot of medical students, junior doctors are choosing hospital-based medicine specialities to go into rather than general practice, and in the medium term that's a real problem for us.
At the moment, general practices are isolated units, small businesses, each operating independently, each going through many of the same processes over and over again in repetition in different places with no economies of scale, no shared voice or representation for general practice in the local area. And there's a sense that if we came together and worked as a group, that we could deliver more, deliver better and ease some of the workload pressure.
In my mind, what we're looking for in integrated care is to make sure that actually that your patient's journey, whether it's in secondary care, community or primary care, functions the same as if that patient was sat in your practice and you suddenly realised they needed a dressing doing. Your nurse is there and that happens seamlessly and smoothly with simple communication. Patient gets what they need and their health improves as a consequence.
About a month ago, the CCG put on an all-practice event where all the Lambeth member practices are invited to come hear about what's happening in the CCG and participate in sort of CCG-generated activities. And what we were asked to do as emerging leaders was to facilitate group discussions, to try and look at what our members think about integrated care, what they think they could contribute to integrated care, what they think the issues are around changing the ways that we work. And through the course of the facilitation, one realised that people have got a lot to say. And in a sense, sometimes it requires a little bit of leadership in order to tease that out.
Primary focus of the phase one was partially leadership development, so there was development for the people selected and so that they'd be given the skills to carry out the work, and a lot of engagement with practices.
I mean, there's nothing better than going out and sitting down with people and saying, how is it? For a couple of reasons. The first one really is just sort of, I think this is bad. Is it really bad? And actually you then go around to other practices and speaking to sort of GPs and nurses in their practices, the same message was coming back. It's quite easy in medicine to sort of resort back to anecdote. We quite frequently do that when we know that we base all our decisions in medicine on evidence, really. And so to go out and collect that evidence, so from a clinician's perspective, that was a really good way of sort of going out and collecting the evidence about how it really was.
And leading on from those discussions, we've had really interesting discussions about what sort of models we might set up, what sort of structures might we need in order to actually deliver the services that our patients need.
Our patients are often frustrated because they don't understand why all the parts of the system don't come together, why one person that they're working with has no idea what the other part is doing, and for them it's all one holistic thing, but for us it's fragmented services with difficult communication. So there's a lot of work to be done in terms of bringing everyone together, in sharing and pooling knowledge and resources and working towards a common goal.
We're coming to the end of phase 1 of the project, and we're about to embark on phase 2, and we've got a very clear sense that through the next phase what we're looking to do is to actually develop the structures, you know, across localities but also across boroughs.
Where Lambeth would like to be at the end of this year is that we'll have 3 federations. All the localities will have a federated collaborative working model, and we will be in a position where we will be able to be providers.
That's obviously going to be quite a challenging task to undertake, but it is a key objective of the next phase of the charity bid.
We spoke to the emerging leaders again 6 months later as the programme progressed through phase 2.
We've been busy within our localities forming federations. So the South East locality we've got together, we've made a decision that we'd like to work collaboratively. We're called the South East Lambeth Health Partnership. So that's just been registered at Companies House, and we'll be looking to recruit our board members within the next month or so. So things have really moved forward in respect of the federation.
We're quite proud of the fact that we have been able to set up legal entities which will allow us over the next few months to start delivering services as different localities.
I thought it was pretty ambitious, but I think after I'd gone around and spoken to the practices, I suddenly felt a lot more confident, because I suddenly thought, everyone's in agreement. I don't think I've ever seen this happen in my medical career, where I've gone round and asked the same question and everyone's come back with a pretty similar answer.
It became very apparent last week at our all practice event, actually. Both Southwark and Lambeth attended. What was really nice is that nobody left halfway through. You know, nobody had their dinner and then left. Everybody stayed to the end. There wasn't any heckling. Everybody was in agreement and nodding. And actually at the end of it, people said, stop talking about it and get on and do it.
Probably the hardest thing was deciding on a name, which probably created more debate than anything else.
We've been working in our localities on building a weekend service where practices will work together to staff and support a 9 to 5 service on Saturdays and Sundays, which started running in 2 localities 2 weeks ago, and it's starting in my locality, the North, next weekend, and that will run through to the end of March. And there's also going to be some funding through to run a weekend dressing service alongside it, which would be more innovative and particularly used to our patients.
I think one of the overwhelming objectives throughout phase 2 is to develop a collective leadership structure across Lambeth and Southwark. It's highly likely that moving forward, the way services are commissioned for patients is done differently. And I think our commissioners will be looking for us as general practice to be developing much more robust relationships with our secondary care colleagues and our colleagues in the council. And in order to have a strong voice within those discussions and within any negotiations that may arise, I think it's incredibly important that Lambeth and Southwark GPs are speaking with one voice.
We're very close in the way that we work. Geographically, the way that we sit, it's kind of quite natural because we use the same secondary care providers. How that structure is going to come together, I'm not sure. I think you've got to get it right at make sure that the mandate's there from the actual federations in the smaller localities, so that people feel like it's actually going in the direction that they've decided upon.
Since phase 2 has progressed, I think we feel even more cohesive as a group of emerging leaders, simply because we're actually getting our teeth into really practical things. For example, services, designing pathways that perhaps we weren't being asked to get involved in previously. And I think through that process, everyone's sense of responsibility is increasing. And I think what you'll find over the next few months is that a lot of the targets that we're setting ourselves are much more likely to be achieved because we're working together.
I've really enjoyed working with the GPs. I think it is a different skill set. I was surprised how much they valued my skill set, and lots of them have said some really nice things.
I mean, changing any kind of direction in the NHS is like steering a supertanker. It's hugely frustrating, and when I worked in hospital medicine for many years before I became a GP, and it's probably one of the reasons why I left, was the frustration of trying to change anything. It just took so long. But I haven't really seen that with this. It's gone quicker than I expected.
I think we've achieved a lot in 6 months, and to have everybody at the same page at the same time in 6 months, I think has been a huge achievement. So I think without the support in respect of money and time, I don't think we would have been able to do it in such a short period of time.
If you'd asked me 6 months ago, would I be happy with where we're at the moment, I think the answer would probably be yes. I think we've done an incredible amount of work in a relatively short space of time. I think the more you do change, the better you become at it. And I would hope that as the months progress moving forward, that we become ever more slick at doing what we do. And hopefully the benefits of that will be translated into real hard outcomes for our patients.